Government has condemned the prevention of access to healthcare services at Kalafong Hospital in Atteridgeville. So it's been reported that Operation Dudula members, or people who are affiliated with the movement, are stationed at the hospital's entrance where they're trying to allegedly block dark-skinned patients as well as some staff from entering the facility. The presumption here is that they reckon that the darker you are, the higher the chances that you're not from South Africa. That at least is the presumption. In some instances, we are told that they ask people to speak a South African language in order to confirm that they're indeed not foreign nationals. Let's get reaction from government now. Bring in the Minister in the Presidency, Mondli, Gungubele, who joins us via our video link this morning. Minister, it's great to see you. Thanks very much indeed for speaking to us on this Wednesday morning. I mean, you know, government has come out quite strongly against this, condemning it in your statement. But let's begin with what you've been told is taking place at Kalafong Hospital.
Thank you, and I think the story of what happened in Kalafong is highly regrettable because it undermines everything that this country stands for. Because this country is a member of the progressive global nations, that affiliates to the progressive principles of the human triumph, which descent, which actually goes across and not on the basis of ethnicity, which actually is against racial prejudice, racial national prejudice, in particular when you are going to deal with those who are vulnerable. So everything that is occurred there stands against that, and it also is also against the constitutional imperatives of this country.
Yeah. It was the Sowetan yesterday that reflected on what they're calling the complexion test. That, of course, has, you know, kind of is reminiscent of the kind of things like the pencil test that took place during apartheid. But apparently people at that institution, Minister, were being stopped on the basis of essentially what they look like. I mean, are those the details you've also received?
So, no, there's a lot of such stories, but the point I wanted to make, Ayanda, is if you were to check people whether they belong to this on the basis of whether they are dark or not, it's an unfortunate perpetuation of inferiority complex, which demonstrates how are we struggling to redeem or liberate ourselves from the legacy of apartheid. It's something that we've got to deal with. How do you then use people's color to do that?
Yeah. This comes, of course, in a greater context of a discussion that's been taking place around how this country deals with the migration crisis, essentially, in the region. The President yesterday speaking in Parliament saying remarks, for instance, by the Health MEC in Limpopo, Popi Ramathuba, have raised important issues. The Zimbabwean embassy has also responded in some instances saying they were taken aback by the MEC's remarks. What's government official position around what the MEC said, and whether or not that was the platform to raise those issues?
Listen, maybe it's important to continue to say, Ayanda, the issue of capacity, the load, that also is underlined by the fact like we also have a lot of undocumented people in South Africa. It's a matter that the government is seized with, because it's a matter that we have got to make sure that it's corrected, that everyone is legally in South Africa. But however, having said that, I go back to my opening statement that the principles of this country, both from the Constitution and even the stance of the governing party, always over years supported the conventions of the professional institutions. That's why I very much heartened by all the professionals, in particular the medical professionals, who actually refreshed their commitment to the oath of service, that you will exercise, you will give your care without national, without political, without racial prejudice. I want to argue that both our constitution and our organization over years have actually aligned with those conventions.
Yeah, I hear that. The President yesterday said the MEC could have done things differently. Do you agree with that?
I think so. You see, I want to tell you that my understanding of the MEC is one of the hardest working South Africans it would have been preferable that those concerns which are genuine would not have been sent to that patient, in the presence of that patient or to that patient, because that patient's purpose of being in the hospital was to actually be assisted as the patient was in a vulnerable situation.
Yeah. As I mentioned, the Zimbabwean embassy here in South Africa has released their own statement, in some instances saying they're taken aback. I think it was Clayton Monyela who has been quoted as saying that there are some kind of discussions taking place with Zimbabwean counterparts, Zimbabwean authorities. Are you able to get us a sense of how far those discussions are and what the nature of the discussions are in a context where there's fears around this leading to some kind of, rift, diplomatically speaking?
Well, I think in any relationship, whether human or international, there will always be some kind of misunderstandings. And it is always ill-advised to think of diplomatic rift on issues that can be clarified, especially when the country is clear where it stands on the matter.
And exactly where is the country on this matter, Minister?
I've already said we stand by conventions of various professional, institutions, whether it's medical, law, and so on. What do we mean in this instance? In this instance, the oath of service of doctors and nurses has always been, you will give the care to the patient without national, political, religious, ethnical prejudice. And I have no doubt that this country is aligned with those principles.
Right. Going back to the Kalafong matter, there's obviously going to be a lot of interest in ensuring that patients as early as this morning will be able to go and receive health care facilities there without any kind of obstacle or hurdle, at least not the kind that we're speaking about today. What are government's immediate interventions to fix that problem?
Naturally, I think the law enforcement agents are expected to be there, but I wish it didn't go to that extent, because we want to say to our people, the issues of undocumented people, the issues of people who are illegally here, should not be confused with the need to exercise or to give care to the vulnerable, irrespective of their national origin.
The government here at home has also faced criticism because what, in fact, interestingly enough, journalists from Zimbabwe have pointed out is what is taking place here in this country is a symptom of the silent diplomacy that the South African government has been engaged in with their Zimbabwean counterparts. In other words, at important moments when this country is meant to speak out, for instance, about misgovernance in places like Zimbabwe, the government here at home is being accused of turning the other way, of being quiet. What's your response to that, Minister? Because that is being seen as the reason why we are where we are.
Well, I think, for instance, if you look at the 7 priorities of government, the 7th one is better Africa and better world. The South Africans' approach when it comes to dealing with misunderstandings with our neighbors, with our international partners, it's not about grandstanding. You talk to those people and engage with them in a solution-enhancing manner. There is an option, of actually speaking in public and saying, we're not happy about this and so on. But the approach of this country with regard to the international diplomacy is we intervene in a manner that can hopefully help. We've got track record in that. Whether you go to Sudan, you go to Nelson Mandela's time in Ireland, there's a number of countries where this intervention, this approach of making sure that you talk to the people who you have got issues with, rather than taking what you call public platforms. This government has been reluctant to do that. And I think I support that approach because you enter an interface in a solution-enhancing manner.
I wonder whether people feel like that approach does work. But, Minister, I wouldn't be doing my job if I didn't ask you about what took place in Parliament yesterday. The President this morning, you'd be hard-pressed to find a paper that's not in some ways reflecting on the criticism that he's failed for what many people believe was skirting around questions around what took place at his Palapala game farm yesterday, in 2020. Do you reckon those people who feel like the President is avoiding accountability are justified?
And maybe let me start by saying, President, before he becomes a president, he's a South African citizen. He has got a dignity he has actually acquired over years. It's a dignity that you don't easily give up on. But how must this be tested? The president has opted to actually subject to independent institutions, be it your Reserve and your SARS, be it your other institutions, your Hawks, over and above. The president is subjected to a parliamentary established process of appointing highly established adjudicators who are independent to actually deal with the matter. And now the parliament wants to do two things. Take the president to a parliamentary gallery where people freely cast aspersions on your dignity, and those aspersions which are not going to be tested against anything. When you as parliament have an option to subject the president to an independent process whose findings are going to be put before parliament. All I'm saying, and where I'm sitting, I dare say this now, that we are dealing with, in my view, especially in parties like EFF, I call it attention seeking when wrong, because if a president subjects himself to all these processes that are established, that have got a track record, why do you deal with him as if he's running away? He's running away from what?
All right, there's plenty else to be said about that, but to say it by the clock, Minister in the Presidency, Mondli Gungubele, thanks very much indeed for speaking to us. I imagine there'll be many other follow-up conversations. But for now, thanks very much indeed.